All right, guys. Well, welcome to episode 230 of the 988 Crisis Jam. Today, we will have a featured presentation from Brandon Graham of NAMI on public perception of 988 insights from NAMI's national poll. So, again, thank you all for joining us. My name is Laura Evans. I'm the AVP of Public Policy and Government Affairs with Vibrant Emotional Health. Vibrant is the administrator of 988. And so we're very excited to have you join us this week for the Crisis Jam. Before we go into this featured presentation, though, we're going to do our recap of news and other housekeeping items. So let's push forward. Just a reminder of the few housekeeping items we have. For the best experience, please be in speaker view instead of gallery view. You can change that on your upper right corner in Zoom. Please make sure that you join in because we want to hear from you, your questions, your thoughts, your feedback. Put those all in the chat. There is an audience poll question, so make sure that when that pops up, you participate. Really, we are here to learn and have fun. The only thing that we ask is to stay on mute if you are not speaking. So we want to make sure that the jam is accessible and fun for everyone else. So please stay on mute. And if you would like to come off mute, please raise your hand and then we can see if we can get you off mute. But in the meantime, you can share that thought in the chat. So those are the only housekeeping items. Thank you for your participation with those in advance. And if you would like to use the ASL feature, that is at the bottom corner of Zoom under More. You click those three buttons and the option for sign language interpretation will be available. If you click that, the interpreter will come into the top corner of your screen and so that you can follow along with the jam as well. So great features. Oh, I love the idea of a word cloud. That would be so fun. So guys, we've been doing this for 5, almost 6 seasons. And so there have been 585 unique speakers since then. I think today, Brandon, you will be added to that full list. So you might be highlighted here in yellow. Let's see if we can find it. My eyes are not good enough for that. But we have 2 pages, so definitely lots of speakers that we have learned from. If you have a topic idea, please let us know. We want to get your name on this list because, again, there's no one authority on this. We are learning from everyone. Everyone has a different perspective, different items that they are doing. So we want to get your name on there. All right, so we will be adding 3 new speakers to this list, Brandon, Holly, and Catherine. Awesome. Well, we have a one-stop shop for everything Crisis Jam. So if you go to talk.crisisnow.com, you will see everything in this learning community it has to offer. You can live stream, you can watch it on YouTube, you can register to get the calendar invites for future jams because we do want to keep this safe. You do have to be validated. Everything you need is going to be on talk.crisisnow.com. So make sure you check that out. And again, you'll see the sneak peek of what's coming. You can get those cool virtual backgrounds. If you don't want to watch the entire video and you're like, hey, I just know that there was something in the news section, we have it all broken out. The highlights, you can see what was on the tech corner, what was on the live and location, what was on the hot seat. So everything you need will be at talk.crisisnow.com. So make sure you go there, stay in the loop. And again, you can watch this on YouTube. Hopefully you're live streaming it with us if you're not on the Zoom. But again, you can always go back. Make sure you like and subscribe so you don't miss a video. And my little tip, here's what I love. They're color coded. So the debates are going to be in neon. You see those there. Blue means it's a live on location. Orange is a fireside chat. Yellow, I think it's just a featured presentation. We have a day in the lives that are green. So again, perspectives of people who are actually doing the work. Very amazing, great catalog of videos. Make sure you check it out and like and subscribe so you don't miss it. So our next fireside chat will be September 3rd. So that's coming up. Make sure you save this date. We're going to have Dr. Art Kleinschmidt, who is the Principal Deputy Assistant Secretary for SAMHSA, the Substance Abuse and Mental Health Services Administration. That's the agency that is responsible for 988, of course, as part of HHS, Health and Human Services overall. But that's going to be moderated by a great friend of the Crisis Jam, and that's Tanja Miles. So that make sure you save the date on that, and that's going to be covering the miracle of recovery. So that's a lot, guys. This is a lot happening, and that's just season 5. So we are coming up on season 6. Our renewal will be in September. So we're going to give you a little sneak peek of what's coming. And this is what I'm really excited about as a government relations person, as a policy person, the battle of the bills, right? Because government, the way that policy, legislation, regulation is written, has an impact on how we treat mental health and how we treat individuals who are in crisis. So we have Senator Tina Orwell of Washington State, again, huge champion of crisis services of the JAM. We have Representative Steve Ellison, who is, again, a friend of the Crisis Jam and arguably one of the architects of the idea of a 3-digit number. They're going to be battling it out for, what type of bills are best for supporting mental health. And again, there's no losers on these debates. So I'm very excited to see this. I'm very excited for this idea. Thank you, Nashbid. And then you'll see here, this is a photo, I believe, of last year's, last year's suicide conference. Someone may have to remind me in the chat. I'm forgetting its name, but you'll see here. Crisis Now 3. Yes, I'm so sorry. In Amsterdam. And so you'll see here just a great collection. So that was in Amsterdam, I believe, last year. And so there will be another Crisis Now 4. And it will be hosted in, I believe, Washington, D.C. I'm looking at Jill's face in this photo. So many great faces in these photos. So make sure there's a link in the chat that you sign up to get more updates. But it will be planned for DC in July 2026, Crisis Now 4, and is going to be in conjunction with the NASHBID annual meeting that is hosted July 26th to 27th, and then immediately following that will be the Crisis Now, What Works, 2 days, 1 mission, the promise of crisis care. And then that is also going to be accompanied by a live in location crisis jam on July 29th at noon. So make your way to DC if you're not already there. NASHBID annual meeting is always great, always phenomenal learning. And then to add on a Crisis Now, you're going to have the best and the brightest there. So make sure that you are there because you're one of the best and the brightest. A little bit of news this past week. You Matter Outreach launches Hope for Improved Behavioral Health Recovery. So again, another initiative to help improve behavioral health recovery for individuals. So love to see that. Make sure you check that out. There's some links in the chat to help provide patients with continued support that they may need in hopes of improving outcomes. Great work from the Huntsman family, the Huntsman Mental Health Institute. The CDC launched a new campaign to address youth substance use and mental health. Again, reaching out to those young people. You can never start too young to make sure that they are taking care of their well-being. So there will be some links in the chat to access those resources. But super exciting and great to see that from CDC. All right, guys, we have come to the former hot seat, now showdown portion. And the good news is that you all here today with us get to be a part of this showdown. So what is the most common misconception about 988? Here's that poll. We want you to participate. All of these items, A, B, C, and D, are misconceptions around 988, but which one do you all believe is the most common for individuals that have been surveyed? And if anyone has any thoughts they want to share about misconceptions that maybe aren't even listed here that you may be hearing in your community, go ahead and drop that in the chat. All right, we've got 72% of the audience saying it's only for people considering suicide. We've got 16% of folks saying that calls are automatically shared with law enforcement. Again, another misconception. No one said that it can only connect you to local crisis centers. Um, and 12% saying you must be in an immediate emergency to use it. These are all misconceptions. Um, but we did not stump you all today. You guys got us. Most people believe that 988 is only for individuals who are considering suicide. And again, just like B, C, and D, these things are not true. Um, it can provide support for any type of mental health issue, substance use disorder, or other emotional crises. So please let's make sure that we are not continuing that misconception, that we are not allowing that to limit folks to have access to 988. But you guys are smart. We couldn't stump you. 988 is for everyone. So with that, we are now at our featured presentation. And so I'm going to turn it over to Brandon Graham. Again, he is the director, I believe, of public policy and advocacy at NAMI. Did I get that right, Brandon?
Very close, Laura, but thank
Oh,
you.
so sorry.
No, all good. Thank you so much, Laura, for introducing. Thanks to everyone at the Jam for having me today to talk about some of these pieces. I'm Brandon Graham. I'm NAMI's Director of Advocacy at our national office in Arlington, Virginia. I've been with NAMI for about 8 years now, come November. And part of my role is making sure that not only are we engaging advocates around our 988 and crisis response work, but we also understand what the public knows and thinks about 988 and efforts to really reimagine how we respond to mental health, substance use, and suicide crises in the country. So, back in October 2021, NAMI partnered with Ipsos, a major research and public affairs firm, to start tracking public perception around these items. I'm going to be talking about our most recent poll that we just released in July, on July 16th for the 3-year anniversary. But we've conducted polls over the course of all of this time. You will see some tracking data, but a lot of this is new data that we put out last month. So next slide, please. So a quick thing, just as a background to the study, this was conducted in late June 2025 using Ipsos online probability-based knowledge panel. So it's a nationally representative sample of 2,022 general population adults over the age of 18 in the US. The margin of error in this data is around 2.3%. And we've seen this really does cover a whole lot of different info. So the report you're going to see today goes into gender breakdowns, income, party identification. But to find the full slide deck, which is about 3, 4 times larger than the slide deck I'm going to go through today, you want to read more on the methodology, see additional top line data or data that I'm not even going to be able to get to. You can learn more at nami.org/summer 2025 poll. Or you can also learn more at nami.org/988, where you'll find all of our polling over the years on 988 and crisis response. So before I jump into specifically some of that 988 data that you really, really would like to hear, let's just talk about the state of how the public views mental health. So if we could go to the next slide, please. So we ask people if they have a favorable or unfavorable view of a few different pieces. You'll see Medicare and Medicaid have very high favorability among US adults. And all the way at the bottom there is the mental health care system. Only 2 in 5 Americans have a favorable view of the mental health care system, and it's underwater because 50% of people have an unfavorable view. So people, when they hear the mental health care system before we do any education or talking about anything else, they have hesitations and they don't necessarily think of it in the best way. And when we start talking about public policy, though, we have to think about what the public wants to see or has been seeing from different policymakers. So on the next slide, we have a breakdown between what folks think their elected officials have done too much, too little, or just the right amount to address the current state of mental health care in the US. And you can see across the board, nearly half of Americans feel every elected official, from their state legislature and their governor to president and Congress, over time has not done enough to address mental health care in the United States. In fact, if you go into like our full slides and our full data, the folks who say any of these elected officials have done too much is I can count on two hands the number of percentage points there. So people really want to see more, and you can see this has been consistent. Uh, yeah, across a lot of our different polling. So over the last few years, we've been asking this question since October 2023 through June 2025, and it's remaining rather consistent. People are not seeing the action they want to see on mental health. So let's get into the really key data for everyone here, which is we've been tracking awareness and whether people know about 988 since October 2021, before it was even live. So on this next slide, you can see that growth of awareness. So if we could go to that next slide, please. As you can see where we started in October 2021, while a lot of folks on this call were aware that 988 was going to become available and be implemented, most people had no idea what was coming. Only 18% of folks were aware, 4% were familiar. Now we are up to 74% of Americans being aware of 988. What does it mean to be aware? That means 3 in 4 American adults, have at least heard of 988 in some way. They might not know all of the different responses that are available or the support that they can receive, but they've seen the advertisements, they've seen the signs, they've heard the updates from people. And it's really important that we've seen that growth. You'll see right after 988 was available nationwide in September 2022, it was at 44%. So we've had a 30 percentage point bump over that time, a testament to the work of everyone on this call. So you have that second line as well. That's familiarity. Those are the people who are most familiar with the types of responses. Now, not we've seen a lot of growth. That's really up from 4%, but that does also show a great opportunity for us to continue educating the public about what 988 is and 988 is, and the types of and when people should reach out, the types of support people can receive, and just what is the whole point of having this easy number that people can reach out to. So we're seeing incredible growth that's doubled since September 2022, and we'll continue to track this data so we can see how the public is starting to recognize just 988 and the work that we have here. So if we can go to the next slide, please. We also ask people about what is most important to them if they needed to contact 988 for them or someone else in a crisis. And time again, the most important thing people state is being able to speak with a crisis counselor immediately. So you'll see a few of the other pieces that people rank really highly. They don't want to receive a bill. Like that's really important and why it's so great that we have 988. And we'll talk about some of the financing later on. And people then rank being anonymous to the person answering them as another top reason, a top important piece they consider when wanting to contact 988. But how many people in our survey have been reaching out and contacting? So if you go to the next slide, we ask people if they or a loved one have ever done or experienced the following. So as you can see, we have a few options on the slide that people selected. So whether people have seen a mental health provider, thought about or talked about suicide or self-harm, tried to see a mental health provider there, but couldn't because of barriers, or they have experienced a life-threatening mental health crisis. So the bars we have up on here are broken down. You see a breakdown between men and women, as well as LGBTQ adults and non-LGBTQ adults. So it is typically higher among LGBTQ plus adults and women to say that they have sought mental health care, but also noting that they reported experiencing a life-threatening mental health crisis. So let's get into this just a tiny bit deeper on the next slide. So then we followed up with people who mentioned that they had a crisis that involved contacting 988. We wanted to know whether or not people feel they received the help they needed following that experience. And we got back 71% of people who self-reported having a crisis and reaching out, that they received help they needed. So 1 in 10 Americans, as part of our survey, contacted 988 for themselves or a loved one. So we've been seeing that number tick steadily up. We've also seen the people reporting positive outcomes up from 55% 2 years ago. So we're seeing more progress in what the public thinks and is reporting back to us around 988. It's really great to see that progress. So let's talk a bit more about some of the policy solutions that really go into reimagining our crisis response and supporting 988. So if you can go to the next slide, please. We we ask about a few different policy solutions, and routinely the top thing supported by the American public has been creating 24/7 mental health, substance use, suicide crisis call centers that effectively respond to callers and follow up later. Support has been 86% or higher in all of our surveys, and the public really shows that strong support. You see 44% of Americans indicate that strong support. People want to see a requirement for all health insurers to cover mental health crisis services. That's an even stronger backing, where you see that darker line on the left. When it comes to funding, 4 in 5 Americans support federal funding and state funding for 988 crisis call centers as well as crisis response services. So you have very strong backing from the American public around that. Now, the last line, we're going to dig into a little bit deeper. But over time, we have seen a bit of people who a dip in the number of folks who just flat out say they support adding monthly fees on phone bills to fund 988 and crisis services. My research team that I work with at Ipsos has a few theories, one of which is costs have gone up for a lot of households over the course of the time that we've been asking these tracking polls. So there are economic factors beyond just 988 or crisis response that impact that line. But I do have some good news in a few slides on this topic. We have yeah, a lot more data around support for different policies that can be found on that web page that I talked about. 86% of adults believe that 988 should be a priority for Congress for federal funding. Over half say it should be a high priority. So people really want to see their policymakers, going all the way back to the beginning, investing in these systems. So if we can go to the next slide, please. I do want to just quickly note that we asked this, we fielded this poll before some of the changes to the Press 3 option. And I just wanted to flag that 60% of Americans support funding services for LGBTQ plus youth. So there is that support across the American public for additional funding to go into that. Not on the slide, I think, is also an important data point, which is 79% of Americans say that young people need more mental health resources dedicated to them or their unique needs. So we see that broad support across the board for ensuring there are more resources to help address youth in crisis. So if we can go to the next slide, because this is where you have a lot of different things up on screen. So I'm just going to talk really briefly about how we go about this. We ask people with a breakdown of fees that how much, if any, would you be willing to pay on your monthly phone bill to fund 988? And you'll see on the left, we have unaided. So we ask people this question directly. And you'll see we're about 72 cents is the mean willingness to pay if you also include paying nothing. So that's great to see. Um, when we start telling people that they're already paying for 988 as 911 as part of their phone bill, after they hear that information, how much would they be willing to pay? And that actually goes up. You'll see fewer people are not willing to pay anything. That's a 6 percentage point decline there, and an additional 8 cents increase in willingness to pay. So up when people learn that we fund 911 via these phone fees, they actually will be willing to pay more to 988. Now, there are some states, of course, that have already uh, implemented fees. So we were curious. We wanted to know whether or not people are even aware they're paying them. We often hear that people don't want to pay more things on their phone bills. They're wary. They're already paying so much. So this must be something that really concerns the average American. But as you can see on this next slide, 89% of Americans in states that have already added a 988 fee to their phone bill are unaware that their state includes that monthly fee. People don't know. They haven't noticed the fees that have already been implemented on their phone bill. We find that fascinating, right? People are willing to pay, especially when they hear that they're already paying for 911. And it's not, at least in this survey, it's not overwhelming burden should they be implemented in a state. So I've run through a lot of data. There is so much more that I haven't even been able to cover. You can find additional breakdowns of data, the full research slide deck, our top lines. You'll find data points like learning that awareness of 988 is higher among 18 to 29-year-olds. That's even up 5 percentage points. But our largest growth in 988 awareness is among Americans aged 30 to 49, right? There's so much more data that I couldn't even cover in here that you can find at nami.org/summer 2025 poll to learn more. So with that, I believe I came in just at time or so, so I will pass it back to Laura. Thank you so much for having me.
Thank you so much, Brandon. That was a lot of information, but I think maybe the top line is that everyone is willing to, or most folks are willing to be a part of the solution, whether it's on the financing side or helping to reimagine everything. So thank you so much for that. Now I'm going to turn it over to our roundtable to just reflect on that presentation and how they may be using it in their spaces. So first, I'm going to turn it over to Holly Stevens, who is the Director of Public Policy with NAMI New Hampshire.
Hi, this is Holly Stevens, Director of Public Policy from NAMI New Hampshire, as Laura mentioned. And we just wanted to say thank you, that we appreciate being able to be here today and comment on this data. So the data does show us how much more education we're going to need to do so that people are aware of 988 in New Hampshire. So we know that if people are not aware of 988, that we can't expect them to be involved in advocating for it and advocating for policies around it. New Hampshire has 424 legislators. We have the fourth largest legislative body in the world, basically, behind only India's parliament, the UK's parliament, and US Congress. So we know that we have a lot of legislators that may be unaware of 988 even existing, given this data, and many more who might have heard of it but are extremely unfamiliar with it. Specifically, this data we expect will assist us here at NAMI New Hampshire and our partners in advocating around 988 funding. You heard Brandon mention the data around 988 funding, which just came out, which we're very, very appreciative of this poll. In the past legislative session in 2025, New Hampshire Senate Bill 255 was introduced, which would have established a telecom surcharge on all New Hampshire phone lines to fund our 988, our two 988 call centers. The bill did have bipartisan support in our New Hampshire Senate, and the Senate then incorporated it into the budget on their side. But because of this procedure, the New Hampshire House never got to hold a hearing on the bill. And as a result, the House was very upset about this, and they demanded that the policy be removed from the budget. And so therefore, a 988 funding mechanism did not go forward in this past session. But we do plan on seeking a sponsor to bring the same bill back again in 2026. And having this data will be helpful as we start planning to advocate again for the establishment of a telecoms fee, since we now know of one place that we can focus our educational efforts around 988, and we'll have a better chance of getting this passed. Since the data reflects that more individuals are okay with or in favor of a 988 telecom surcharge when they're aware that they already pay for a 911 surcharge, we can really focus on educating our legislators and the residents in New Hampshire about the way that 911 is funded. And additionally, we can educate them about the amount they currently pay for 911 and the amount that we estimate that they would pay for 988, which in our state would be about half as much as they're paying for 911. And with that, we're hopeful that the data will inform our advocacy so that we can get a 988 telecom surcharge established in New Hampshire next year. So thank you so much for allowing us to speak on this topic.
Thank you so much, Holly, for your advocacy in New Hampshire. So I'm also going to bring into the roundtable discussion Adrienne Bridenstine, who's the VP of Policy and Communications with the Behavioral Health Systems Baltimore, to share her perspective and what they've been doing in the advocacy space there. So Adrienne.
Hi, thank you for having me. So as Laura said, I'm with Behavioral Health System Baltimore. We're a nonprofit who serves as a local behavioral health authority in Baltimore City. And we've led a lot of advocacy around 988 in our state for the past several years. I'm happy to report that Maryland is one of the states that already has a telecom fee. We passed a bill almost 2 years ago to establish a 25-cent telecom fee. We were able to do that using some of the research that came out of NAMI National at the time and looking at their polling and then trying to replicate it at a state level. So it was really helpful to us then. For the polling that's just been done, I have three main takeaways from what's been done. One, I think it's really fantastic that we're starting to see progress over time, so that the polling has been done a couple of years ago, that NAMI's continuing to do it, because I think that's really valuable to show and track trends over a period of time. Some of the takeaways that we have is that the polling results align with some of our local market research that we've done, that we've been using to promote 988 throughout the Baltimore community. So it's showing that callers are looking for immediate relief. And we saw that in some of the data that Brendan presented. So to us, that's telling us that we need to continue to promote 988 as a resource for immediate relief, because that's what callers are looking for, and that it's free and confidential. The other takeaway that we had from that slide is that people are calling 988 and really, really don't want police. So that relates back, I think, to how our 988 operates and responds. And what we're seeing in the greater Baltimore area is that we are able to resolve most calls over the phone and very, very rarely use police. So the data is helpful to see also how we're implementing and operationalizing our 988 service locally. I also think the polling results on LGBTQ plus was really interesting. It's also showing that we need to reiterate still that 988 is for everyone, even though the press 3 option went away. I think you can do that through 988 marketing with imagery, for example, using the pride flag in how you're promoting 988, but it's really, really important that we continue to promote 988 as a resource for that community. If we need to be careful about the language we use, right, because of oversight from the federal level, just promoting that 988 is for everyone is really important, because the data is showing us that LGBTQ plus folks want this resource and really need this resource. And the final thing I'll say is, again, just I really appreciate that NAMI's been doing this polling over several years, because it's showing that people are starting to gain trust in 988, and that's what we want. So hopefully we'll continue to see that trend continue.
Thank you so much, Adrienne. And I just want to thank you personally for your advocacy. I know you've been doing this in Maryland for some time, and so it's great to see the success. And I think that's perhaps another thread here as we hear about the data and the work from Adrienne and Holly, that maybe the first year that these things are offered or introduced don't work, and you have to keep going back at it. But just because we don't get what we are looking for, either in a fee or other changes that first year, doesn't mean that we let our policymakers off the hook. We have to keep continually educate them about the need for these systems changes. So thank you for sharing that, Adrienne, and thank you, Holly, and thank you again, Brandon and NAMI, for your work there. So yeah, let's give a big clap for our speakers. Now I'm going to transition it over to Dr. Richard McKeon for SAMHSA update.
Thank you so much, Laura. And it was wonderful hearing all of the information that the NAMI Ipsos survey has been collecting. I can't wait to go onto the NAMI website and do a deeper dive into these findings, including how they have changed over time. So I'm just going to mention a couple of things. As was mentioned earlier, of course, 988 Day is coming up, September 8th. And, we would be grateful for everyone's participation in getting the word out around 988, so that next year's NAMI Ipsos poll will continue to show that upward trend, not only in awareness, but also with familiarity. So we will definitely look forward to that. Of course, September Suicide Prevention Month. September 10th is World Suicide Prevention Day. The Suicide Prevention Branch at SAMHSA has released a toolkit to assist organizations regarding activities for Suicide Prevention Day, so would call your attention to that. I also just wanted to mention briefly, 2 weeks ago, there was an important conference that was put on by SAMHSA Service Member Veterans and their Family TA Center. And this had to do with work funded by the Veterans Administration. So it's a VA SAMHSA collaboration. And it aimed at improving, expanding mortality review across the country. It's been a major priority for VA. And this meeting, and so there have been several conferences focused on this. 2 weeks ago was a summit in Northern Virginia, which brought together all of the different teams who've been working on this to share information. Also in collaboration with the National Child Fatality Review folks, because they have been doing suicide mortality reviews for many years now. So important that we learn from each other. And finally, just to make you aware that for 988, there is what we call a sentinel event review process that would look at deaths by suicide or other fatalities, serious injuries, significant kinds of problems that could happen, rare though they are. So Vibrant, as our Lifeline administrator, has a process for doing a review of any of these sentinel events that they learn about. And then similarly, SAMHSA's state and territory 988 grant requires there to be a sentinel event review process because we owe it to those that we have lost and to their families and loved ones to learn everything we can when, despite our best efforts, someone has been lost to suicide. So I am going to stop there and thank you for the opportunity to give the SAMHSA update.
Thank you, Dr. McKeon. Again, you, the entire 988 office, and others within SAMHSA and HHS, we're just so thankful for your work on this because it has been quite the journey. And so hopefully, as you mentioned, we'll continue to see awareness increase for 988. So thank you for that. And thank you for the toolkit, and excited for 9/8 Day. So now we're going to move forward to a NASHBID update, and I'm going to hand it off to Sherry Dawson from NASHBID.
Thank you, Laura. And I wanted to share a session from the NASHBID annual meeting that ties into the perception of the mental health care system, I think, that you talked about, and also opportunities for us and advocates and all of you to continue to grow full continuum. At the NASHBID session on the future role of state hospitals, Ted Letterman, who many of you know from NRI, presented a paper that was about the evolving role of the state hospitals in the public mental health system. And a couple quick data points from that paper. 25% of states are building new or replacing existing hospitals or reopening closed beds. And this was primarily seen to the growth of the individuals that are needing incompetent to stand trial services, competency restoration services. And if we looked at the spending, state hospital spending was at about $14 billion, or 25% of state mental health authority spending, but serving only 1.4% of over 8.4 million individuals served by the state mental health authority. So we talk about continuing to grow this full crisis continuum and community services. We had an informative panel with two mental health commissioners, one from Kansas and Virginia. We had Dallas Earnshaw from the Western State Psychiatric Hospital Association and Wendy Morris from NASHBID, really focus in about their vision for the future of state hospitals. And they all really focused and desired and really wanted to reverse that growth of state hospital beds that we've seen here in the last few years to truly serve individuals with the most complex needs. And eventually, over time, as we can continue to make those investments into the community services, utilize those state hospital clinicians as consultants within community settings that also serve individuals with complex needs, and hopefully prevent an admission back to a state hospital. And then also continuing to grow the state hospital programming, more evidence-based opportunities, promoting healing and recovery, and then becoming really elite and proficient in technology and adaptive technology, not only just for the workforce challenges, but also, and most importantly, for the patient services and supports in their programming. So in the meantime, the panel had some suggestions and work, and this comes back to the policymaker discussions from this morning, while reimagining and redesigning the future. All of the participants, including the panel, prioritize that continued expansion of community-based crisis services and making those strategic investments, trying to take that money instead of in those higher end services to really expand community services and supports as well as housing. And that will help really the system flow and hopefully shut some of that front admission door and allow individuals to continue to live in their community with the services and supports that they need. And really focus again on those forensic opportunities where we can serve individuals better in the outpatient community-based and jail-based settings. And also thinking about the State Psychiatric Hospital Association and state hospital partnerships with those community connections, and making sure that individuals in state hospitals also know about resources like 988 and preparing their crisis plan. And do they know where the crisis stabilization centers are and peer recovery support transitioning into the community? How about an iPad like in Oklahoma and other states for individuals transitioning out of the hospital so they're well connected and educated? So they had a lot of information and strategies. I want to thank you for the work that you do every day and challenge you, like I did the audience, to think about maybe one policy, practice, a partnership, a program that really could continue to help our system of care serve individuals in new and connected ways. Thanks, Laura.
Thanks so much, Sherry. What a great challenge. I hope that we can all pick that up because we can all do something. Again, whether it's talking to your friends, community, lawmakers, advocates, participating with NAMI, AFSP, Mental Health America, let's pick up that challenge and see what we can make happen. So with that, I'm going to transition us over to a very exciting conversation that I am eager to hear more about. And again, you can read this full article on talk.crisisnow.com, but we're going to turn it over to Stephanie Hepburn to learn more.
Thank you, Laura. So I'd like to welcome Dr. Catherine Warburton. She's the Medical Director of California State Hospitals. Dr. Warburton, can you share a little bit about why California shifted from an imminent danger standard to medical necessity, and then also what you found in Italy as guidance for best practices?
Sure, and it's really interesting to come right after that update from Sherry Dawson on the state of state hospitals. I'm a forensic psychiatrist who's been working in forensic state hospitals and prisons for my entire career. And I'm really talking about a very specific group of individuals, and that is individuals who are living with severe chronic symptoms of psychosis, hallucinations and delusions that are leading them into criminal legal involvement and unsheltered conditions. And we have thousands of those individuals every day in California who are locked in prisons, jails, and forensic state hospitals. And so this one particular reform that you're asking me to speak of, Care Court, is designed to prevent individuals who are living with psychosis from ending up in those locked settings or cycling through those locked settings in the open streets. So it's hard to say all of this in about 5 minutes, but we have recognized that it's important to recognize that we're living in one point in time, and that in this country for the last 250 years, the policy pendulum related to people living with chronic severe psychosis has been swinging from neglecting individuals in our communities. In the middle of the 1800s, individuals were chained to walls or kept in cages and completely neglected, to 100 years later, neglecting that same group of individuals in large, overcrowded asylums. And as we enter the middle of this century, 100 years later, we are again neglecting these individuals as they cycle through the streets and the carceral settings. And the policy pendulum is starting to swing. There are plenty of signals that it could continue to swing back into neglect within institutions if we can't find nuanced, careful policies that can keep individuals stable and living in their communities. And so understanding that history and learning from countries like Italy, where they don't have state hospitals, they don't have forensic hospitals, they don't have people living in psychosis in prison, and they have very few people living unsheltered. Rather, individuals in Italy who have positive symptoms of psychosis are stable and living in their communities, living meaningful lives. And so it's important to look at what they've done differently and to try to learn from that. So in California, the CARE Act is designed specifically for that very small, specific group of individuals. It has to be someone who's experiencing symptoms of a schizophrenia spectrum disorder. And there is one aspect of the CARE Act that is completely involuntary, and that is actually the system. The CARE Act is designed to order the system to provide the evidence-based services that we know keep people stable in their communities. And so a civil court judge can order a mental health delivery system to provide housing, to provide wraparound services like assertive community treatment, and to provide adequate medication management. So that's one aspect of the CARE Act, which is to try to replicate accountability that's found in Italy by putting accountability on the system via a civil court order. And
just to interrupt you for 1 second, one comment that you made that stood out when you were talking about the percentage of people admitted for competency restoration who'd been arrested, in the research that had been done, 15 or more times increased over a period of 7 years, from roughly 18%, I believe, in 2009 to 46% in 2016. Can you tell me how that contributed to these data responding changes? What did that mean for you and other policymakers to make a shift to move away from the dangerousness standard?
And I want to be clear that we still have a dangerousness standard that prevails across most populations in California. What the CARE Act does related to medical necessity is if an individual lacks medical decision-making capacity due to psychosis, there can be a medication order designed to overcome the challenge of trying to get informed consent from someone who lacks medical decision-making. There's no element of forced medication in the CARE Act. It's merely to overcome that lack of medical decision-making capacity. So that's an important thing to point out. We've done exhaustive research on thousands of individuals being sent to us on felony IST restoration orders, and have found that 2/3 are homeless, half have not received any Medicaid reimbursable mental health services in the 6 months prior to their arrest. And we did see that remarkable increase in criminal justice contact with arrest rates skyrocketing. And our hypothesis is that individuals who are living with chronic psychosis have drifted into an untreated, unsheltered condition. And when we looked at their arrest reports, they were getting arrested because they were unsheltered, untreated, and living in poverty. So they were stealing food, they were trespassing, trying to find a place to sleep or take shelter. They were being arrested because they were paranoid and responding to hallucinations in the community. And so we've set up a massive diversion system in California. But we're very concerned that if we have this mental health system that includes assertive community treatment and housing and adequate medication services, on the other side of that felony arrest, it would have the unintended consequence of driving more felony arrests. So the CARE Act was designed to catch people who are at risk of falling into that IST cycle, or who were in the IST cycle, and get them stabilized with services in the community without having to have that criminal legal involvement.
When you went to Italy, you talked about the policies nationwide, but You talked about the special sauce that you saw in Trieste. Can you talk a little bit about what that looked like? What is the special sauce?
Yes, I can talk about that. It's important to talk about the Basaglia Law of 1978, which happened sort of after we had the Community Mental Health Act of 1964. And so the Italian system looked at what we were trying to do and implemented their own deinstitutionalization movement. Theirs worked. What they did in 1978 is they outlawed state hospitals, forensic hospitals. They shifted, eliminated a dangerousness standard for treatment for individuals who lack medical decision-making capacity in favor of a medical necessity standard, and they guaranteed a right to mental health care. So those things taken together have led Italy nationwide to have probably the gold standard mental health system. But in Trieste, they take it a step further, and they have social services where individuals have a right to a job, to appropriate housing, and then something that is indescribable, I think, in the English language, but it's a sense of familiar warmth. They have what they call microenvironments and social collaboratives where the communities really come together to provide all of their vulnerable community members with a sense of community, everything from getting prescriptions refilled to getting a ride to the doctor to fixing your broken washing machine. There's really a social safety net in that particular region of Italy that sets it apart from a system that is already functioning at a very high level to serve individuals with these severe forms of chronic psychosis.
And just to conclude this, one thing that I thought was very interesting is what can be done in the United States, because what you mentioned is here's the best practices model, here's how we can have these. And we've even talked about organizations that have tried, but what do they run into and what can be done in the United States to take us there?
This is my personal opinion. I think we need to be able to start having frank, nuanced conversations about how to deliver services for people who have a neurological condition that prohibits them from being able to take care of themselves. I think we need to be able to have frank, nuanced conversations about the unacceptability of allowing people to starve on our streets. And those nuanced conversations require some discussion of voluntariness, which is a continuum, but has become an ideological third rail in this country. And without those frank, nuanced discussions, I do fear that the conditions on our streets and our prisons and jails will drive changes that are far too radical. And we'll find ourselves 100 years from now, again, with neglected, institutionalized populations. So I think we need to come together as people who truly care about this population to have those nuanced discussions before those discussions are had for us.
Thank you so much for joining me. I'll pass it back to you, Laura.
Thank you, Stephanie, and thank you, Dr. Warburton. I mean, what a fascinating discussion. We have lots of conversation in the chat. So I wish we had more time because I'm interested in these questions. And again, how are we paying for things and financing? And again, how can we all do our part? I'm willing to pay a little bit more to make sure that we are serving people. Great conversation. Make sure you check that out on talk.crisisnow.com. Coming soon. If you like that, there's more. Stephanie Hepburn will be hosting a Crisis Talk podcast. And I think, Stephanie, if you don't already have a topic, that is a great first one.
It is. Yeah, so I'm pretty excited about this. I'm going to try to keep it very similar. We're going to be having conversations, but as opposed to me writing the articles, I'm going to bring this other format, another medium to communicate with people so that while they're cleaning or exercising, they can hear these conversations and hear people and get direct quotes from the individuals that I'm interviewing, but I'm very open to people sending me an email. You can do that at editor@crisisnow.com. I'd love feedback. This is a new transition for me as well, so we can learn together. But I will also, I'm thinking too of keeping a transcript that's there or a summary so that when you go, you can either listen to it or also read the content as well. So that's
Yeah.
where I am right now. Email me if you have questions or if you have thoughts or feedback or suggestions. I'd appreciate it.
Thank you, Stephanie. I'm super excited. Make sure you guys email her. There are great topics. I see the comments. Stephanie, if you don't mind putting your email in the chat there,
No
I am
problem.
super excited just following that discussion. I wish we had another hour. But you guys will just have to join us next week when we have episode 231. We're going to shift a bit, and it will be a day in the life, part 4. So again, that 4th part of the crisis continuum, someone to follow up. So that will be next week. And then we have 2 weeks from now, building the crisis response with Ted Letterman, episode 232. So make sure you mark your calendars and join us next Wednesday, noon Eastern, and again the Wednesday after that. Thank you, and I hope you guys have a great day.